Well, good afternoon to you. Thanks for tuning in. wwjb.com is how you're going to stream us online. If you're listening on the radio, of course, 103.9, 92.3 on the FM side, 1450 AM. And, of course, the second and fourth Friday of every month, you can tune right here for a live show here today with Dr. Joanie Davis, Davis Family Hearing. It's all about you, all about hearing on JB Radio. Reminder, Davis Family Hearing can be found at various locations throughout the area. There's one on Cortez Boulevard, State Road 50, and Spring Hill, of course, on Spring Hill Drive and Newport Richey on Little Road. Dr. Joanie Davis will give you more information on that. Without further ado, thanks for tuning in to Here Today on this Friday. And I'm going to turn it over to Dr. Joanie at this time. Doc, how are you?
I'm doing fabulous. How are you doing today,
John?
John?
Very good, very good. Always love having you in the studio here.
Thank you for having me.
Yes. You bring such a fortitude of information and education, and that's so important because we need that. We don't know what we're looking for, what we're doing as far as hearing is concerned, but it affects all of us.
Absolutely. And, you know, there's a ton of information out there about hearing loss, and unfortunately, a lot of it is misinformation. And I'm a firm believer if you're educated about what's going on with your health and your body, the treatment is so much more effective. I have a ton of patients who will come into my office with a pair of hearing aids that are only a year old and say things like, these don't work, I need new hearing aids. And I'll take a look at them and they'll be top of the line hearing aids. And I'll take a look at them and say, you know, these are actually excellent, but the prescription is wrong.
Oh my goodness.
I can't tell you how many times people come into my office with existing hearing aids, and all we have to do is reprogram them. And at the end of the day, they look at me and say, this is exactly how I thought that they should be working. It's just like glasses. If you get the wrong prescription in your glasses, you're going to get tense. Things are going to be blurry. You're not going to want to wear them. And sometimes they can actually make the problem worse. The exact same thing with hearing aids. So I encourage anybody out there who thinks that hearing aids don't work to bring them in and have us take a look at them and see if we can get them working the way that they should for you. Very
good. Now you bring up the fact of glasses as well. As we get older, our vision sort of gets worse and we have to change that prescription maybe on a yearly basis. Is that the same with hearing?
Absolutely.
Okay.
We test all of our patients' hearing once a year unless they perceive a change earlier. But the reason we do that is because your hearing can change. And if it does change, we can take your existing hearing aids and just update the prescription for you. It doesn't mean a new hearing aid. Unfortunately, there are places out there who may employ some high pressure sales, and that is part of the reason why there is a perception that you always have to buy new hearing aids. And what we do when you come into Davis Family Hearing is take a look at the individual, see if what you're wearing is appropriate for you, and make it work for you. Of course, if it's not, you do have the option of getting new hearing aids, but that is determined on an individual basis based on your needs.
Well, now we've heard the commercials, and you offer a 30-day free trial period. Tell us a little bit more about that.
Absolutely. I'm a firm believer you should be able to experiment first before you make a decision. And we offer a free consultation, a free hearing test, and then a free 30-day trial period if you do decide to try a pair of hearing aids. During that trial period, we bring our patients in once a week, make sure the prescription is appropriate, make sure that the product is appropriate. And if it's not, you do have the opportunity of trying different models and different manufacturers.
Wow.
We work with every single manufacturer that exists, so we can definitely get what works for each person who walks through the door. I've had multiple people say, well, I don't know which one I want to try, and try 3 different models. And I've even done blind comparisons before and not told them which model they were trying. And then they chose at the end which one worked the best for them.
Wow.
I actually love to do that. It's really fun to see, and I get a ton of information from it. But at the end of the day, if you decide you don't want to purchase anything, you absolutely don't have to. You have the option of returning them or purchasing them. And we develop a relationship with our patients. It's not just like you're coming in and buying a pair of hearing aids and saying, I'll see you in 5 years. Hearing aids in Florida in particular endure an awful lot of wear and tear. We have humidity, salt water, people perspire, and there's an awful lot of dirt and debris and dust in the air, and that can get into your electronics. I mean, you're wearing an electronic device on your head all day long. So we bring our patients in every 2 to 4 months for preventative maintenance, and that's all included in the cost of the hearing aid, and it keeps it working the best that it can for the duration of the life of the hearing aid, which should be anywhere between 5 and 8 years. I mean, they should last a good long time for you.
That's great. And last time you were in the studio here, Here today, once again, a show by Dr. Joanie Davis, sponsored by Davis Family Hearing, heard the second and fourth Friday of every month at 12 to 12:30. Opportunity for you to chime in and, of course, to get educated on hearing from the doctor herself. It is an Ask the Expert segment, so that gives you the opportunity to chime in and, of course, always contact the doctor you hear on the radio here today. Now, last week, like I said, when we met, I didn't have an opportunity to ask you about how earwax affects that as well.
Absolutely. We all produce earwax. Well, not everybody. There are some patients who don't, but if you get a buildup of earwax, it can cause hearing loss, can cause discomfort, it can cause itching in your ears. A little bit of earwax is actually extremely healthy because we want a little lining in there to moisturize it so it doesn't itch. But when it tends to be a big buildup, it can cause hearing loss. And we have all sorts of methods to clean that out of our patients' ears. The number one thing, and this is kind of a soapbox for me, don't use Q-tips.
Yes.
Everybody always says, well, if Q-tips aren't meant to clean your earwax, what are they meant for? And I always just say whatever else you want to use them for, applying makeup or whatever else. But what actually happens with Q-tips is if you do have a buildup of earwax, it pushes it down in your ear canal farther and gets impacted. So it's a little more challenging to remove. We have to soften it and use different techniques to get it out.
So if you learn one thing from this show, do not use Q-tips.
Well, it's kind of like the old adage from your mother.
You're right.
Nothing smaller than your elbow in your ear.
Thank you very much. Now, there's other resources out there as well. Like I've in the past used ear candles.
Yeah. Ear candles don't work either.
Yeah.
And one of the main reasons I know this is because in grad school, we did a research project on it and I was the guinea pig because I do tend to accumulate earwax. And basically there's a chemical in the candle itself that looks like earwax whenever you burn it.
Yes, I've tried
But it doesn't actually remove anything. The best thing to do is to see a qualified professional to have it removed.
Because you look at those things and you're thinking, wow, that much earwax came out of there, and it's really actually the wax from the candle. So now you have a prescription that you give out as well for a little solution that we can make. But before we get to that, what about this new thing that's out on the market, this little auger thing that you can stick in your ear to clean out the earwax?
I order everything that comes out, and I believe that one has a vacuum in it as well.
Okay.
And I ordered one, and on the commercial, they show it sucking up a droplet of water, and that's fine, but I put it in my ear because I actually had earwax whenever I did it, and it's not powerful enough to do anything.
Okay.
They're not going to provide anything that can actually cause damage, and a lot of times, that's why you need to see a qualified professional. It's deep in your ear canal, and earwax usually has a pretty heavy consistency, so you need a decent bit of suction to be able to get anything out, and that auger doesn't go in very deep, so if it's on the outside of your ear canal, you might be able to get it out, but they're not going to let it go in too deep to damage anything. Rule of thumb, I've never seen any of those $10 to $20 things on TV actually work.
Now, what about the solution that you've given me that in the past, a little prescription or a little, you wrote it down and I think you printed it out and you handed it out to people. So what about that little solution there?
Absolutely. We have two different things that we'll do. If you've never had an eardrum perforation or a hole in your eardrum, that's very important. You can use equal parts, and I usually use a half a tablespoon or so of white vinegar, rubbing alcohol, and hydrogen peroxide. Put it in your ear canal and hold your head to the side for about 5 minutes, and then dump it out on a towel and just kind of take your pinky in the towel and dry your ear canal out. If you do that once a week, it usually does a very good job of keeping the earwax out. I say usually because it's very effective if you come into my office, get it removed, and then use it once a week. I never have to clean your ears again.
Wow.
But before cleaning, it usually just does a softening. A lot of times if people come in with hard earwax or itchy ears, I'll have them put a drop of extra virgin olive oil in their ear before they go to bed at night, and it does a very good job of soothing itchy ears as well.
Very interesting. Very interesting. Okay, so I know you came fully loaded with what you wanted to talk about today, and I feel like I've taken up all your time with these questions, but there's just so many questions, What about your staff there that works with you? Let's touch a little more on that as well, because you've got such a wonderful, every time you see the pictures, you got these beautiful ladies here, and of course, you're always in the middle there. You stand right out, and that's Dr. Joanie Davis, of course, and Davis Family Hearing. You don't have to always see Dr. Davis. There's other doctors there that are available. So
I'm a very lucky girl. I have the best staff on the face of the earth, from the person who answers the phone and schedules the appointments up to my other doctors. Everybody who walks in the door is going to see my front office staff or a lab technician, and they're always greeted with a smile. I get comments about that all of the time. We actually all enjoy our jobs and improving everybody's quality of life, so everybody's smiling and laughing all of the time. But I do have two other fabulous doctors, Dr. Michelle Frenton and Dr. Amanda Perkins.
Okay.
Dr. Frenton has been working with me since I opened my practice. She actually did her residency with me from the University of South Florida. She has a passion for fitting hearing aids and cochlear implants and working with patients of all ages, and she will do whatever works the best for you. I have several of Dr. Frenton's patients who they see me and they're like, you're not Michelle. Why is Michelle not seeing me today? And Dr. Perkins comes to me from West Virginia University. She also did her residency with me, and she's our pediatric audiologist. She does see patients of all ages, but she does have a passion for pediatrics, and we've been working with newborn infant hearing screenings at Oak Hill Hospital and tons of pediatricians in town. We see children for ear infections, cochlear implants, hearing aids, and she just recently introduced auditory processing disorder testing at our office. And we're also the only practice in town, only practice in 3 counties, really, Citrus, Hernando, and Pasco, who do auditory processing testing.
No kidding.
Well.
Wow. And you're also, from what I understand, the only office that provides cochlear implants.
Yes.
That's
yes,
wonderful.
we are.
Right here in the ear. I mean, you're right here. How could you not?
It's huge.
Yeah.
It really is huge. And the reason is because usually cochlear implants are programmed in the hospital or the facility where the surgery is done. And what I have done is partnered with top surgeons in Tampa and Gainesville to do my surgeries. And we have a really open communication with the offices, and they just refer them back to us to do the rehabilitation and the mapping of the hearing aid, or of the cochlear implants themselves. And patients are finding us who just needed a little bit of maintenance, but didn't want to drive all the way to Tampa to get it. So as a result, people who are using these devices are hearing better with them because we're in their backyard, and they're perfectly comfortable coming in and seeing us and making the 5-minute drive instead of the 2-hour drive.
Yes, that's wonderful having that relationship, especially with the doctors in Tampa and Gainesville, which are two of the most prominent areas for those, medical doctors and those different they've got the colleges and the different hospitals, et cetera.
Absolutely.
So, yeah.
And if I'm referring somebody for surgery, I have to trust that they're getting the best surgeon on the face of the earth. I mean, it is brain surgery, so I have to make sure that I have the best, and the surgeons that I work with are in the top 5 cochlear implant surgeons in the nation. So I have utmost faith in them.
So there you go. Another reason to see Dr. Joanie Davis, and of course, Davis Family Hearing. All the doctors at Davis Family Hearing are there to help you with all your hearing needs, all the way from pediatrics to cochlear implants. So we're going to take a quick break, and we'll be right back after this. A little word from our sponsor. And once again, you're in tune to Here Today with Dr. Joanie Davis on JB Radio. Be back after this, folks.
Hi, this is Dr. Joanie Davis of Davis Family Hearing. Most people don't know we are the only cochlear implant provider in 3 counties. We are able to service the needs of every degree of hearing loss that exists. If you're interested in finding out if you are a cochlear implant candidate, call today at 352-666-8910 or visit us at davisfamilyhearing.com. We have 3 convenient locations, one located on Cortez Boulevard, one on Little Road, and one on Spring Hill Drive.
And you heard it straight from the doctor's mouth, Dr. Joanie Davis with Davis Family Hearing on Here Today. A program brought to you as part of the Ask the Expert segments here at JB Radio. Second and fourth Friday of every month. We're glad you tuned in with us this afternoon. And of course, with all your questions, you can always contact the Davis Family Hearing offices. They've got 3 to choose from, by the way, right here locally on Cortez Boulevard. Their phone number is 352-666-8910. Spring Hill office, of course, 352-666-8911. And if you're in Newport Richey, 727-375-8111. But it is a pleasure to have her live in the studio here with us, and of course to tackle those issues that you're dealing with. So I'm going to hand it over to her to continue.
Absolutely. I do want to take this moment right now to talk about a huge event in town tomorrow, where you can come get your hearing screened and take a look and see if you have any earwax in your ears. Turlap Chiropractic is putting on a huge health and wellness extravaganza, and they've been kind enough to feature Davis Family Hearing as the featured doctor. It's not a health fair. It's really a screening fair.
Yes.
Everybody who is there is offering a screening, and just a few of the people on the list. I mean, there's going to be a ton of people there. Suncoast Braces, Senior Helpers, Walmart Vision Center, Deaf and Hard of Hearing, Services of Florida are going to be giving away free amplified telephones. They'll be in the room next to us, so we can identify hearing loss. And if you don't pass the screening, then you qualify for a free amplified telephone through the state of Florida. The Lighthouse for the Blind is going to be there, AARP, United Way, Meridian Research, and they work closely with dementia and Alzheimer's. I mean, the mammogram bus, they're going to be doing free mammograms as well.
And that's filling up, I say, because you got to make an appointment ahead of time from what I understand.
Yes, yeah, absolutely. If you actually go on Turlap Chiropractic's Facebook page, I think there's a link there that you can click on to go ahead and schedule an appointment to get your mammogram done.
Cool.
I mean, it's a really, blood pressure, they're doing blood pressure, cholesterol, BMI. I'm not going to do the BMI. I don't want to know what it is. But come on out. It's always fun. And it's going to be tomorrow, February 11th, from 10 o'clock in the morning to 1 o'clock in the afternoon. And it's at Turlap Chiropractic. And the address there is 8466 Northcliffe Boulevard in Spring Hill. And if you need any more information on it, feel free to call Turlap Chiropractic at 352-666-2222. All three of my doctors are going to be there. Dr. Michelle Frenton, Dr. Amanda Perkins, and myself are going to be there, available to answer any and all questions you have on hearing loss and balance and cochlear implants and hearing aids and earwax.
Yes.
From pediatrics all the way up to geriatrics. And again, we'll be able to take a look in your ears, see if there is any earwax or abnormalities, and test your hearing for you.
That's a perfect opportunity, folks, to come out and meet Dr. Joanie Davis. Tell her you heard it on JB Radio, of course, and her other doctors as well. And not only that, but get those free screenings there at Turlap Chiropractic. And, you know, we do have a show with Dr. Turlap in here as well each week. And he's been, talking that up, and just, I hope it's going to be a great event. I know it will be.
They make a huge difference over there. I mean, I do really like to partner with them for different events, because they have what they do affects people's overall quality of life, and it's a huge improvement in quality of life. And we've had discussions about this in the past, about how both of our practices really, we feel that we have the best professions on the face of the earth, because we do make such a huge difference when you treat a problem that's causing a communication problem, or in his case, there's physical pain. When you're able to fix that, I mean, people's lives just improve dramatically, and in turn, their relationships with their loved ones do as well. When you can alleviate stress through communication or pain, it really does just bring everybody closer together.
And that's why we're very protective of our listeners here on JB Radio, and that's why we only bring the best to you. And that's why we offer programs such as here today with Dr. Joanie Davis, and of course 30 Minutes to Vitality with Dr. Tim Turlap every week. So thanks for tuning in once again. Now that's going on February 11th. It's a extravaganza at the Turlap office. That's tomorrow. You don't want to miss that. It starts at 10. Get there early. I know it's going to be busy, like all of his different events that he holds there each year. And once again, stop by, say hello to Dr. Joanie Davis and her staff, and tell them you heard it here on JB Radio. All right, so you go from pediatrics to geriatrics. What about in between there? You get a lot of folks that are hearing loss can occur from anything.
Absolutely.
So tell us a little bit more about who you treat and what you treat.
We treat everyone, and there's several different reasons for hearing loss. I mean, a lot of people go by that old stigma that because you have hearing loss, you're old,
right.
And we're seeing newborns all the way up. People can be born with hearing loss. They can take medication that's caused hearing loss. There can be genetic malformations. You can have noise exposure, all sorts of different things. A virus can attack your ear. But we see a ton, honestly, probably the largest majority of our patients are working age patients, anywhere between 35 to 60 years old, which is why, we have fun with everyone, but I in particular love working with the business professionals in town, because we have so many invisible solutions, and they're just completely floored by the fact that we can treat their hearing loss and nobody can see that they're wearing a hearing aid. My two most popular products I fit on that population are the Lyric, which is an extended wear invisible hearing aid that stays in your ear canal 24/7. Nobody can see it. It's literally like not having a hearing loss. But my other hearing aid that I fit a ton of is my Halo Bluetooth hearing aids.
Okay.
They Bluetooth into your cell phone.
Right.
If you have, it's primarily Apple products. They're working on it for Androids right now. But when you get a phone call, you answer your phone and it goes to both of your hearing aids and you're completely hands-free.
Goodness.
You can stream music from your phone. You can stream Facebook videos. I mean, we have all sorts of stories that people come in and tell us. This one dad come in one time and say that it's great because he can turn the football game on while he's sitting at the dinner table and nobody has any idea that he's listening to the game while he's at dinner. I have business professionals that wear them in meetings and people have no idea that they're streaming music to their hearing aids.
Right.
And the cool part about it is you can control your own settings.
I saw that.
So if you're in, let's say, I would say if you're in Red Lobster, and in general, your programming is pretty much spot on, but if you get into a challenging situation and you need to tweak it a little bit, you can put your finger on the screen, move it around until it sounds good, and then store it as your Red Lobster program. And then it's geotagged in your phone.
Yes.
So the next time you drive to Red Lobster, it automatically kicks into your Red Lobster program and you don't even have to think about it.
Incredible.
Can also turn your cell phone into a microphone and leave your cell phone on the table, and it has a 100-foot range.
Okay.
So if you're out with friends and you want to hear what they're talking about after you get up from the table, you can leave your cell phone on the table, go to the restroom, and hear everything that's going on. So there's so many different features. I mean, that's just the tip of the iceberg, but they're really little computers and Bluetooth devices. I have several professionals and politicians in town that go, no. I'm not wearing a hearing aid. I'm wearing a Bluetooth device.
There you go.
And, it makes hearing aids cool. These are not your mother's hearing aids. And my patients go around bragging about their hearing aids.
Yeah.
We make them invisible, and then they go out and tell everybody they have hearing aids. It's a thing of beauty.
Well, that's so cool. It's like I don't even have to have hearing loss to get that because it sounds so cool. I mean,
actually, the manufacturer, when it first came out, I was speaking with my representative, and they all got a free pair of them, whether they had hearing loss or not, so they could stream music. I've programmed them myself to talk on the phone in the car so I could be hands-free and worn them home.
Oh, there you go. I was just going to bring that up as well. So that, it does work because of the different software programs now they have in cars with Bluetooth, that would work through your car. So we know that in today's society, there's cameras everywhere, but now you got to watch it. There may be microphones everywhere. So we got to watch what we do, what we say.
You never know who's listening.
Right. Never know who's listening. But if you're not listening, your opportunity to listen again is through Davis Family Hearing. And Dr. Joanie Davis and her staff are always so courteous and make you so comfortable at her offices. I've been to several of them, although I don't wear hearing aids at this point. I have been by the offices, and they do make it so comfortable for you, so easy. And how do folks make an appointment with you, Doc?
All you have to do is call our phone number, 352-666-8910, and one of my friendly staff members will answer the phone and get you squared away with an appointment at your convenience. You can also visit us at davisfamilyhearing.com, and we have a contact us section on our website, and it goes directly to me, and I get you to the appropriate person to schedule your appointment.
Wonderful, wonderful. So we got a couple minutes left. Is there any last words or one thing you want to touch on before we leave today?
Well, one thing I want to tell people is I always say the hardest part about treating your hearing loss is getting to the door. It takes the average person 7 to 10 years from the time that they notice that they have a hearing loss to actually do something about it. And there's a lot of anxiety involved in it because you don't know what to expect. You've heard some horror stories out there from hearing aids that have been programmed improperly with the wrong prescription. And I always tell my patients the hardest part about this is getting to my door, because once you get inside that door, set the first foot in, you're going to see smiles, you're going to feel like your family, you're going to be comfortable, and then you're going to get the highest level of care that you can possibly get. There's a reason that I only hire doctors of audiology, board certified doctors of audiology at that. That's the highest degree that you can attain in audiology, because I want to make sure that we are up to date on every last treatment option possible so everybody can have their hearing loss, their tinnitus, which is ringing in the ears, and their balance symptoms treated by the most educated professional that you can get, but also by people who care what happens to you and who are going to make it a very easy experience for you. Just today, on my way over here, I saw a patient and she said, I love coming to your office. I never love going to any of my doctors.
That's
and I always reply, well, I don't have any needles. That makes a big difference.
Oh, yes, it does. Yes. White coat syndrome, the minute you hit that door, a lot of times you feel just that it's just so uncomfortable or just so uptight or just, I don't like to see doctors either. But you make it, like I said, so comfortable and so easy. And even if you don't have hearing loss, come in and get a hearing test anyway. You never know what you're missing.
Absolutely. There's no charge to come in, and it's always a good idea to get a baseline. Get a baseline for our vision. We should get a baseline for our hearing, and then we can monitor that and check it a year, 2 years down the road and detect any changes. It can also be applicable to diagnosing other health disorders as well.
Okay.
Sometimes something else will be going on in your body, and it'll affect your hearing, and it'll help us provide your primary care doctor with a diagnosis.
Like the relationship between hearing loss and cognitive functioning.
Yes.
So we'll touch on that again in the future. It's been here today. Thanks for joining us today. We are going to be back again 2 weeks from now, the second and fourth Friday of every month at noon. Dr. Joanie Davis on JB Radio here today. Keep that in mind and give Dr. Davis a call at 666-8910 and tell her you heard it here on JB. Stop by and say hello at the health fair tomorrow at Turlock Chiropractic. And thanks for coming in again.
Thank you very much. A pleasure as always.
We'll see you next time.